Good morning. Welcome and thank you for joining us for week 9 of our Northern Light Health Business to Business Zoom conference. Today we have a very special guest, Dr. Nirav Shah. Dr. Shah is the director of Maine Center for Disease Control and Prevention, or CDC. He and his team of healthcare professionals have worked tirelessly during this pandemic to determine public health policy, advise the governor and her cabinet, and provide communications to inform all of us across Maine. For many of you, and I'll include myself, Dr. Shah has become the face of our state's official COVID-19 information source. In fact, he has come to represent the truth about COVID-19, the person we can trust. I'll further share with you that Dr. Shah's team of physicians meet with Maine physicians several times per week, supplementing Dr. Shah's message with further detailed guidance and cutting-edge scientific information. They too are terrific. Today, we also have a very special Northern Light health expert. Dr. Jim Jarvis is someone many of you have come to know on these weekly sessions and his numerous media briefings. Dr. Jarvis is our Director of Medical Education and has been intimately involved in all aspects of Northern Light Health's response to this pandemic. He too has worked tirelessly, representing Northern Light Health by working closely with other medical leaders across Maine. He's a critical member of our incident command, assuring Northern Light Health is ready for everything this virus can throw at us. Today's session will include a conversation between Dr. Jarvis and Dr. Shah, followed by questions and answers, which I will moderate. The topics today broadly will include, as you can see up there, a history of this pandemic, what's currently going on, and what the future could look like. I'm Dr. Ed Gilkey, the Senior Physician Executive for Northern Light Beacon Health. Before we get started, I'll read our legal disclosure. Coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply to your specific situation, and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. In regard to employment, every situation is unique and must be reviewed on a case-by-case basis to ensure compliance with the law. The information presented should not be taken as legal advice, and you will need to retain your own counsel to review specific questions regarding employment situations and/or accommodations in your organization. Well, we've designed this hour to offer you Dr. Shah's insider view. I invite you to use the chat function to ask questions. You can do this anytime. I'll keep track of your questions and have our two doctors respond. Welcome, Dr. Shah and Dr. Jarvis. Thank you for making the time in your very busy schedules to share your expertise and insights with our audience this morning. Dr. Jarvis, please start our conversation with Dr. Shah.
Thank you, Ed, and good morning to everybody. And Nirav, I just want to thank you for your time and giving that to our audience. As you're aware, we've been working diligently to assist non-healthcare entities during this reopening process and are so glad to have you today. If you remember back in January, you and I had a conversation about the early stages of coronavirus, and I think we chatted a little bit about a family member of yours that was in Africa at the time, and our concern seemed to be more focused in on how this would affect third world countries. But my question to you to start off our conversation is, when did you first realize that this was going to affect the entire world and the way that we do things?
Well, thanks, Dr. Jarvis. And let me first thank you for the kind invitation to join today. Really excited to chat with everybody and take questions and chat about what's going on. I commend Northern Light for hosting this webinar series. The more education that we can get out there from respected, credible, authoritative sources, the better off we'll all be across the state of Maine. And so I thank Northern Light and all of your colleagues, Dr. Jarvis, for putting this together. So in our case, in my case, with respect to coronavirus, I first started getting concerning emails from friends and colleagues that I used to work with 20 years ago when I got my start in public health, which was in Southeast Asia. And because I'm still on some of those listservs that are still active after all these years, I started getting and seeing emails back in mid-December from folks saying, not sure what's going on, but there's a couple of people in a small central Chinese city that have a virus, some type of pneumonia, and it doesn't seem to register on any of the diagnostic tests. At that time, it was a medical curiosity. These things pop up almost every week in different parts of the globe. But after Christmas, though the frequency of those emails and the number of individuals that were being reported by former colleagues of mine on these listservs started growing significantly. And around New Year's Eve, in fact, on New Year's Eve, is when I think a lot of folks in this small community of infectious disease epidemiology type started saying, boy, this is going up, up, and up, and not really going down in any meaningful way. Right after we got back at Maine CDC, after the New Year's holiday, so around January 2nd or January 3rd, I pulled my team together and said, I'm not sure what's going on in central China, but it has all the makings of something that could expand well beyond China. And so I tasked some of the folks on my team to start keeping tabs on things. And out of good measure, I checked in with our Director of Emergency Response, Mr. Bill Jenkins, to see what our PPE supplies are. I checked in with our lab. I started checking in with our teams. Of course, as everyone is aware, not long after that, it was declared to be an epidemic. And then shortly thereafter, it was really thought to be something that could affect not just central China, but the entire globe. Fortunately, those early preparatory steps that we started taking here at the CDC paid off many months later because we already had the organizational infrastructure in place to tackle what we saw to be coming on the horizon.
Yeah, for myself, I know you and I had that talk in January, and we were hoping it was going to be contained to at least one portion of the world. But then I traveled to the West Coast in mid-February and started to talk, and I was at a conference with other physician leaders, and some of them had already started to see the increase in cases in their emergency departments in California and Washington State. And I know for myself, that's when I started to go, well, wait a minute, this isn't going to be contained, and it's going to take us a while. I know a question that a lot of people have is, how did this even get started? Where did this virus come from? We've heard lots of memes, none of which were accurate, and some of which are downright scary. And so can you kind of tell us what we think right now as to where this virus originated?
Well, I like the way you frame the question because you focused on what we know right now. This is an evolving situation, and as scientists do what scientists do, we will certainly know more a week from now, let alone 6 months from now, about all of this started. But based on what we know right now, there appears to have been an event somewhere in central China where the virus that seems to have been circulating for quite some time among other animal species, most likely the candidate being the bat, but maybe some other animal species as well. The virus seems to have been circulating in those species for a while, but somehow, in some fashion, it jumped from those other animal species to a human. Because humans had not been exposed to this virus before, we had no built-in immunity toward it in the way that we do for hundreds of other viruses out there. The other thing that seems to have happened is this virus seems to be able to be transmitted at a rate much higher than, say, the seasonal flu. And so this transmission event, this jumping from perhaps a bat, maybe to another animal, and then immediately and eventually to humans, is what kicked this off. What this really means is that going forward as a society, we have to evaluate our relationship with nature. These viruses don't spring up from nowhere. They are already out there. And it's because of our close and increasing interaction with nature that events like this could continue happening in the future.
Thank you. That was a very well described process there, and I think different than what some people are hearing on the media. And again, it's why we appreciate you being here, so we can get factual information out. Facts over fear is definitely what we need to be doing. I do want to turn a little bit of attention to where our audience is at, and you and I were both, you were definitely involved in the discussions and the determination of closing businesses. And in my opinion, I think Maine did a great job in being in the forefront of there. I continue to state that schools across the state of Maine were closed prior to schools in New York, and obviously New York was ground zero at that time. And so how was that determination made that we were going to decide to close industries and then eventually close schools?
Sure. So at that time, way back, say in March, what we knew about the virus then, as compared to now, what we knew back then, that it was highly transmissible from person to person. The other piece of data that was just starting to be described was the possibility that it could be transmitted during a time when individuals did not have any symptoms. Many of you may remember hearing about this at the time. There was a famous paper or letter that was published in the New England Journal of Medicine that raised this possibility. And I remember getting briefings from the US CDC about this. When you take those two things into consideration, the possibility that the virus can transmit very quickly from person to person, and the possibility that it can transmit before folks have symptoms, you're left with a situation where it can rip through a society very quickly. As a result of that, given that at the time there was no medication, whereas now there are a few medications that are in hand, given that at the time we didn't know what the peak of the curve might look like, in a situation like that, the precautionary principle, that is to say, take every precaution to save human lives, is what governs our approach. What we knew about the virus, what we know about all viruses, is that when they can spread from person to person, being in close contact with one another is one of the main drivers. That's where the idea behind things like closing down businesses as well as closing down schools came from. It was a way to reduce the congregation of individuals and ultimately reduce transmission of the virus. Now, we make these decisions recognizing full well the human and economic impact they have. We don't just look at these things from one lens. We take a multifaceted approach. But on balance, given that at that time, we didn't know what would unfold, we wanted to do the one thing that we knew was most important, and that was protect human life. And so that's why the decision was made to shut down not just businesses, but schools and a lot of normal everyday social activity. We've now started dipping our toes back in the water in different ways because we know so much more about the virus now. But back then, very little was known.
So I'm going to put you on the spot. Do you think that we did it too quickly? Did we do it too slowly, or was Maine just right?
So that is of course the $64,000 question that historians will have to answer as they are writing the chronicle of COVID-19. And I will answer your question in a moment, but I want to make an observation. One of the things that is interesting about emergency response and pandemics in particular is that everything you do before the pandemic arrives is seen as reactionary and maybe even overreactionary. But then everything you do after the pandemic arrives is considered to be too late. So with things like making decisions around closure, when we did those things, it was before the virus had arrived in major ways in Maine. And there were folks who said that we were overreacting. But then after the pandemic arrives, there are folks who second guessed whether the timing of that was right and maybe we should have done it sooner. What I think is important in analyzing those decisions after the fact is not using the lens of what we know now, but rather what we knew at the time. And I think given what we knew at the time, which is to say not knowing how it might unfold in Maine, one of the things that we kept in mind was the demographics of Maine. As everyone is probably aware, we are, by average age of our population, the oldest state or tied for the oldest state. We have a lot of individuals who are medically vulnerable based on their pre-existing health conditions. So we wanted to take steps to protect everybody. My candid view, Dr. Jarvis, is that I think we got it right. We didn't do it so early as to introduce undue economic or social disruption, and we didn't wait too long such that the virus could gain a foothold here as it did in New York and as we're seeing in other parts of the country right now.
Yeah, and I'll want to follow up with that is when you talk about what we know now versus what we knew then. Really, I continue to hear people go, "Oh, well, your predictions were so far off that clearly we overreacted in this in this pandemic." Early on, we had predictions that would say that we would have up to 10,000 or more hospitalizations with COVID-19 here in Maine, 1,000 people at a given time in an ICU, maybe needing ventilatory care, and thankfully that never happened. But again, as you said, it's what we knew then and what we could see happening in other parts of the country that allowed us to minimize that. And so, in my opinion, I think the state did a great job, and that we minimized what the disease process would have been here. And yeah, it was reactionary, but reacting in exactly what you said. If we put the lens on of it's our jobs to protect human life first, and that's what we did. I do want to ask you, why was it that neither the federal government nor our own state started talking about social distancing or physical distancing and face masking as early on, even when we started to see some other countries instituting those practices and seeing that it was decreasing the spread of the virus?
Yeah, that's a question that comes up quite a bit. I'm glad you raised that. So we did talk about social distancing early on, because as with any respiratory virus, we know that there is a zone of safety and then a zone where it can be transmitted. But face coverings were a bit of an oddity with COVID-19. And it goes back to the the observation I made a moment ago about this business of where COVID-19 can be transmitted before folks have symptoms. So let's compare COVID-19 to the influenza virus, the virus that causes the disease influenza. The thing with influenza is that the time that it spreads the most is after individuals are already feeling really sick. And that is most typically the time in which they are laid up in bed at home or maybe even in the hospital. They're not out walking around. Early on, we didn't know how COVID-19 would react, but most respiratory viruses typically spread when people have symptoms. They're coughing, they're sneezing, and that's what's propelling the virus. But by that time, folks are already inside. And so in that situation, the value of a face covering is unclear, if not really unknown, because there's no chance of spread before people have symptoms. That's why there wasn't a hard recommendation by the World Health Organization or the US CDC. But in mid-April or so, the data became much more clear that COVID-19 can and does spread before people have symptoms. That's a complete game changer when it comes to things like wearing a face covering, because that means by wearing a face covering, you can prevent spreading COVID-19 inadvertently before your symptoms develop. Right around the time that those data started coming out is when the recommendation for wearing a face covering changed. So if you go back and look at videos with folks like Dr. Fauci from February and March saying, you don't need to wear a face covering, keep in mind that was before the data around what is called asymptomatic or pre-symptomatic transmission were really known. I distinctly remember being on a phone call with one of the deputy director for infectious disease at the US CDC, a highly respected doctor named Dr. Jay Butler. And he convened a special call with me and my counterparts to brief us on the emerging data that CDC had just collected around this asymptomatic transmission. And Dr. Butler said on that call, this is going to change the way we think about face coverings. And he was right.
Yeah, once again, it just highlights that when we're talking about science, it all has to do with what do we know now, and then look back at what we knew then. And I think that has been the challenge. As you are well aware, we continue to hear people use that original thought that we didn't need to use face coverings as a reason not to do them now. But our science has changed, our knowledge has changed, and we have improved upon that.
And, Dr. Charles, if I could just weigh in on that, I've been thinking a lot about this because that is how science and medicine should work, right? Imagine, for everyone viewing today, imagine one of your loved ones developed cancer and you went to an oncologist who graduated from medical school 25 years ago. And the oncologist said, hey, by the way, I graduated from medical school 25 years ago, and you know what? I haven't read a single article. I haven't been to a single conference since then. I still practice medicine and use the drugs that were available 25 years ago. I don't know about you, but if it were my family member, I'd grab them and walk right out the door. We want science to keep evolving. We want our doctors to keep applying the best and latest data. That's what you would want if it were your own family member. That's what public health does as well.
And I love that analogy, and it's a valid one. And I think the pandemic has caused us to evolve so quickly that sometimes people lose sight of that exact thing. You don't want to, used to talk about, you don't want to have us practicing medicine from 25 years ago. Now it's, you don't want us practicing from 5 months ago. And I absolutely agree. I do want to change things up a little bit. And we talked a lot about the past. I want to talk a little bit about the present. So right now, how do things stand in the state of Maine?
Well, that's I chat with folks at 2 o'clock on Tuesdays and Thursdays, and I was in the process of getting things ready to kind of provide an assessment. And I'll give everyone a sneak preview. Right now in the state of Maine, compared to other states, things look favorable. Our positivity rate, which is the number of tests that come back positive compared to all the tests that are done, is under 1%. That makes it the lowest, if not tied for the lowest in the country. That's favorable. The number of new cases that we've reported has been quite low. Today, for example, there were only net 5 new cases. Those are favorable things. But to say there are storms brewing around us, certainly in the South, certainly now starting in the Midwest, but even in the Northeast. States like Massachusetts and Rhode Island are experiencing, just in the past 7 days, increases in the number of reported cases. And so while things in Maine continue to be favorable, thanks to the hard work of every single person in Maine for doing things like wearing face coverings, there are storms brewing all around us, and we've got to make sure that we keep our feet on the gas, keep wearing those face coverings. I would like to preserve all the good work that's been done so those fires don't arrive here in Maine.
What about testing? We hear lots about testing and how we feel that testing is certainly a way that we can keep the virus under control by knowing what's out there in our communities. But where's the state of testing right now in Maine?
Sure. So right now in the state, we are doing approximately statewide, not just at the state laboratory, but at the laboratory at Northern Light and all of the laboratories that serve the state of Maine. We're testing approximately 170 people per 100,000. To put that number into real terms, that translates to about 2,500 to 3,000 tests per day. According to different models that are done to try to get a sense of what our number should be, we are standing in a good place. But every single day, my team and I hear from people in Maine who say, I started feeling symptoms and I couldn't get a test. Or I got a test, but they told me the result wouldn't be back for 7 or 8 days. So we very clearly understand and acknowledge that we have more to do to make testing more available, as well as to make it more rapid and return results in a faster time period. That's what we're working on right now. Overall, as a state, our numbers are favorable, but that completely neglects the fact that a lot of individuals across the state are still having challenges getting testing, especially when they need it.
With that said, we've all heard about the supply chain challenges, that we have challenges in getting the swabs, the transport media, the little plastic bags those go in, and even some of our labs having trouble getting the reagents that help run the analysis for these tests. Anything that you can kind of talk about as to what's on the horizon for us or how that might be improved?
Yep. So I'll speak to the swabs first, because that has been an area of concern of mine personally. Governor Mills and I and others that work on this have made our voices heard to members of the federal government to say that one of the key elements of more testing is going to be more swabs. We at Maine CDC have, independently of all the federal government assistance, independently been working with a wonderful company based in Maine called Puritan, based over in Guilford. And they manufacture one of the swabs that we really need. And our colleagues at Puritan have been great partners and helping the state of Maine get supplies. As a result of all of those efforts, we've actually been able to increase the supply of swabs considerably just in the past 4 or 5 days. We've secured supplies that are on their way. In fact, 40,000 swabs just got delivered to our laboratory yesterday, or the day before yesterday. So the swab supply is looking better than it did than if we had had this conversation 4 or 5 days ago. The other piece that is, of course, has been in the news for months is those reagents, the chemicals that are needed to do the testing. And for here, I can only speak to the Maine CDC laboratory. I can't speak to hospital laboratories. But several months ago, the Maine CDC entered into a partnership with another Maine-based company, IDEX, that makes diagnostic tests predominantly for animals, but also for humans. And because of IDEX's vast ability to make testing supplies, we have been able to expand our testing capacity significantly and not be limited by the availability of chemicals that other states have been limited by. Our goal right now is to take those things and expand them as far as we can across the state. And we're doing so in partnership with groups like Northern Light to set up so-called swab and send sites across the state, where folks can drive up, get swabbed, and have those results sent to our laboratory and have those be turned around as quickly as possible.
That is wonderful news. And again, Northern Light's very happy to work with the state on that particular prospect, and we hope to be able to continue to advance testing across our state so that we can answer those questions. I know a few people are, definitely concerned about the travelers that come in, both workers and guests into our state, and wanting to be able to get them tested in a timely fashion. So that's very good news to hear, and hopefully we'll be there. I do want to move us along a little bit to talk a little more about the future. And so we think that the answer to when we can get back to some sense of normalcy won't happen until we have a vaccine available. Any updates on where we are with vaccines right now?
Yep. So the vaccine, let me start with the question that is very much on everybody's mind, which is, when is a vaccine going to be available? Or when will different vaccines be available? I wish I had an answer for that. I don't. According to Dr. Fauci, he's optimistic that we may have a vaccine as soon as the end of this year or perhaps at the beginning of next year. I trust Dr. Fauci immensely, and I hope that he's right, but I don't have any particular insight into the when question. However, in the past 2 weeks, a number of the candidate vaccines that have been under development have published some early results from their phase 2 trials. These are trials that look at the safety as well as an early look at how well it works in people. And the data from these early trials has been encouraging. That suggests that the pathways that these biotech manufacturers, working with universities and researchers, it suggests that the pathway that they are on is the right pathway. So the real question now, and what Maine CDC is working on, is not so much what vaccines will be available. That's a decision for the biotech industry and the FDA, but the how. How will we then take the vaccines that get delivered to Maine and distribute them efficiently, fairly, and equitably? That's what our team at Maine CDC is spending a lot of time working on right now. We're not sure when a vaccine is going to be distributed, but what I am focused on is making sure that when we get the call that says, hey, Maine CDC, you guys got 1 million doses of vaccine coming your way, I want us to be ready, having worked with partners on the ground, to start distributing and administering the vaccine to everybody who wants it.
And that dovetails into my next question, which is we have been starting doing preparedness for that, but are you worried about this coming influenza season as well?
Absolutely. We are. I can't underscore how much I am concerned about this upcoming influenza season for a number of reasons. The first is that influenza is really bad. And although we kind of talk about the flu as if it's a head cold, the real influenza is really serious. And a lot of people die from it every single year in Maine. The second, though, is that the symptoms of the flu are nearly indistinguishable from the symptoms of COVID-19. And one of the things that I would like to urge everyone to do is that as soon as the flu vaccine is available, as soon as you get a call from your doctor's office saying the flu vaccine is here, please make time to go get it. By getting vaccinated against the flu, you lower your likelihood of, say, needing to be in the hospital. You lower your likelihood that your doctor may not know whether the symptoms you've got are the flu or COVID-19. And of course, above everything else, you take steps to protect your family. So we're definitely worried about the flu, and I really want to urge everyone to get the flu shot this year.
Amen to that. Preach it, preach it, preach it.
Mm-hmm.
I'm gonna finish up this session before we get to other people's questions and answers. Is what lessons have you learned during this last five or 6 months?
The three most important lessons that I've learned. Number one is with respect to communicating. We're taught in communication boot camp to always be straight with people, and I've always tried to do that. But what I've really learned from a communications perspective is the following: if someone asks you what time it is, don't tell them how to build a clock. Always tell people exactly what time it is if that's what they're asking for. I've tried and I've learned never to sugarcoat things and always give it to people straight. Number two, I have learned more than I ever could have appreciated how much this effort is a team effort. And the corollary of that is that one of the things that I focus on every single day is how to take care of my team. If folks are struggling on my team, if they're working 16 or 18 hours, what can I do to give them a break? What can I do to make sure that their work life, it doesn't suffer because of the demands that are being placed on them? And again, these are things that I knew, but that I've really learned how to put into practice. And then the third thing has been the importance of taking care of ourselves. For all of us, for everyone watching, not just healthcare providers, not just folks who work in public health response, but for all of us. I think we say that a lot, right? We talk to people and we say, hey, take care. But it hasn't been until COVID-19 that I really realized the importance of asking people to take care. And again, these are all things that we all know. We know it's important to be straight with people. We know it's important to take care of our colleagues. But until it's put into stark relief right in front of you, putting it into practice and actually doing it, that's been the key.
Thank you. Thank you very much. I'm going to now turn it back to Ed, and we'll start our question and answer period. So Ed?
Well, thank you, Dr. Jarvis. Dr. Shah, your reference to Dr. Jay Butler was a very fond memory for me. I had the privilege of working with Dr. Butler in Alaska. Thanks for that smile.
Yes, yes.
We'll now shift gears to addressing questions from our participants. We've received questions before and during this session. We'll try to get to all of them, and we'll group the like questions. The first question is for both of you, starting with Dr. Jarvis. So this pandemic has made each of us wiser. In what ways are you wiser from the experience thus far?
That's a great question, Ed, and one that requires a little bit of thought. But I will say that for myself, sharing a little bit what Dr. Shah just said, that it's taking care of the people who work for you that is incredibly important. Many of us have worked very, very long hours on various different things. I have learned to be far more nimble than I was before. Getting that call at 8 o'clock in the morning that says, hey, we have this happening, and being able to respond to it in a much quicker time has been important. But I think the thing that I learned the most is really about collaboration. Very early on in this pandemic, the 4 major health systems in the state, and then here in Bangor, the 3 healthcare agencies in the city of Bangor, Northern Light Eastern Maine Medical Center, St. Joseph's Hospital, and Penobscot Community Health Center, we looked at each other and said, we are no longer in competition with each other. We are here to save lives and to work together. And for me, I am much wiser because of my colleagues giving me information, sharing information, and working together for the collective good. So I'm wiser by learning that collaboration is the key for our overall success, and especially in healthcare, we should never be in competition with one another.
And Dr. Shah, in what ways are you wiser from this experience?
I believe, for me personally, the one thing that I feel maybe wiser about is my comfort level with saying three words that I think people in science struggle with saying, which is, I don't know. And in a pandemic, you will never know everything at the time that the decision might need to be made because science hasn't caught up with the questions. And I have gotten more comfortable, and I think as a result, wiser by saying and being straight with people and saying, I don't know the answer to that, whether it's people on my team, other stakeholders, or with the public.
Great, thank you very much. Our next question actually is for both of you as well, and this is more on a personal level. Besides work, what have you done outside your home with your family? Describe the precautions you took. So Dr. Shah.
Okay, so we have, my family and I have taken the precautions to heart, which is to say when we're somewhere where we can't socially distance from others, we always try to wear a face covering. We try to limit our interactions with folks to reduce the likelihood of transmitting the disease, et cetera. But Dr. Gilkey, what I want to underscore there is that taking those precautions does not mean we haven't been able to enjoy ourselves and get exercise. So for example, one of the reasons my family and I were really excited to move to Maine was so that we could do things like going hiking, going cycling, spending time at the ocean. And we've been able to do all of those things while simultaneously staying safe. So just this past weekend, my wife and I went hiking down in southern Maine. We had our masks with us so that when we saw people on the trail, we threw them on. We go cycling a lot as a way to get outside and get exercise. That's something that can be done safely and still make sure we're still taking care of ourselves by getting exercise.
Great, thanks. Dr. Jarvis, how about your experience with your family?
Very similar. My family has some certain health issues that we need to protect ourselves a little bit more, and so we definitely take that into consideration. But we do go outside. We do go hiking and have our face coverings. We go to the supermarket. We go shopping. But we make sure that we are wearing our face coverings. And I have always been one to hand sanitize. My kids say I've never walked by a hand sanitizing station without utilizing it. And so just continuing that process. We also found new ways to socialize. We are social animals, so we need to have contact with other individuals. So instead of having large parties like would have traditionally happened, we may only have a family come over to our house and remain socially distanced out in the backyard where we can be a little bit more comfortable with each other in doing those things. And then frankly, we've enjoyed each other's company, which is hard for me to say because I'm always the first one to tell you that I don't really like spending a lot of time with my family. That's not really true. But you know, very early on, we started playing board games again. You know, the things that we did when we were younger, we started to do again. And but you know, definitely some frustration sometimes being a little bit in close contact. But we do get out there and enjoy what Maine has to offer for us.
So I think what I heard is, you know, taking the time to still enjoy life, enjoy your family, but take this virus very seriously. That's what I think I heard. Great. The next question is for Dr. Shah. Actually, it's two questions, and they're related. Why are we not seeing people using face masks and social distancing in Maine? Is this not what we are supposed to be doing? And then, even grocery stores and convenience stores do not make their employees wear them. Is this okay?
So let's start with the first question. And as we think about this question, let's think about how much has changed in the world over just the past couple of months. In February, if I had suggested that the discussion we would be having 6 months from now, today, would be about mandatory face covering, something that has never been part of American culture, it would have been just, no one would have believed that. And so this concept of wearing a face covering everywhere is a new one, and it's going to take time. What I think about is not so much the people that aren't wearing a face covering, but marvel at how many individuals are. For me, it's a little bit like when seatbelts came out, where there was initially a lot of resistance to wearing seatbelts from different quarters, but eventually it became the norm. face covering similarly might take a little bit of time. Folks have different reasons for not wearing face coverings. Some of them don't believe the science yet. The science, however, is pretty clear that face coverings do in fact reduce the transmission. Others may feel that the face coverings are uncomfortable, much as seatbelts are. Those are the things that we do to take care of themselves. Governor Mills has issued executive orders empowering and now requiring large retail stores like big grocery stores to put into place mechanisms so that individuals either must wear a face covering, or if they don't, they be provided with alternative means of, say, getting their groceries, curbside pickup, things like that. So individuals should be, if they're in the grocery store, they should have a mask on, they should have a face shield on, they should have some covering that reduces their likelihood of transmitting COVID-19. Is it 100%? No. Just as if in the early days of seatbelts, it wasn't 100%, but it has been getting better. Earlier on, almost every day our office was getting flooded with complaints. The velocity of those complaints has slowed. We still have a ways to go toward getting to what we need to have for face coverings, but it's getting there.
So I think the takeaway of that for all of us on this call is to encourage face coverings. Great. Dr. Shah, actually this grouping is for you as well. If someone tests positive and has no symptoms, how do they know when they will not give it to anyone else? And then a follow-up question you can answer as well. Of those that test positive, what percentage don't have symptoms? So really kind of looking at that asymptomatic and when they're clear.
Great. So let's talk first about the latter question, because I hate to introduce more complications into a straightforward question.
Yeah, right.
However, an important distinction here are individuals who are asymptomatic throughout the duration of their illness, as opposed to those individuals who are what is called pre-symptomatic. That is to say, they don't have symptoms yet, but they might later go on and develop symptoms. Those are actually two different categories. A lot of people are pre-symptomatic. That is to say, they don't have symptoms at the time they get diagnosed. But a large fraction of those individuals later go on and develop symptoms.
Mm-hmm.
The number of individuals who are truly asymptomatic throughout the course of their illness, it varies depending on the population. A paper from just a couple of days, about a week ago, suggested that net, it's maybe at most 20%, maybe even a little bit lower. Another fraction, a large fraction, just don't have symptoms when they are diagnosed. Now, so then how do we know when someone is safe if they never had any symptoms whatsoever? Well, the US CDC has guidelines on that. And it really does depend on when they were tested and when they may have been exposed. But generally speaking, it's approximately 10 days after the time they were tested, not uniformly and not universally. And that's what Maine CDC epidemiologists focus on when they're working with people after they've been confirmed. There's not a one-size-fits-all rule, but it's rather based on population studies the US CDC did on asymptomatic individuals to measure the level of virus in their body every single day, and then use that to base the recommendations on. Dr. Butler was involved in many of those analyses, and it's thanks to Dr. Butler's excellent briefings that state health officials and state health departments have that information on hand.
Yeah, great.
He's a personal hero of mine, by the way, so delighted to let you know.
I understand why, actually. So thank you. The next series of questions, Dr. Jarvis, I'll send over to you. I've worked with you in the course of this pandemic, and know you have a lot of experience with this, so I'll ask away. What if the employee brings in an unrequested doctor's note stating they cannot wear a face mask? Is a face shield a viable substitute? And then a follow-up question is, what if they cannot wear a face shield either?
Yeah, so those are excellent questions. So right now, the CDC states that a face shield is not equivalent to a face covering. As we continue to talk about, the science is evolving on that, but we do not feel it provides the same level of protection as a face covering. For those who flat out cannot wear anything that covers their mouth and nose, I think employers really should look at accommodations for that particular individual, whether that be a work from home option, or finding a way that they will be isolated from other individuals within your industry. This is going to be difficult, particularly as we start looking at schools. We know that there are going to be some children who have behavioral or developmental challenges that make it difficult for them to wear a face covering or shield for a prolonged period of time. And how will we not only keep them safe, but keep those around them safe? And so I think you need to look for guidance as to how you can make accommodations for an individual who has some rationale. I will say there is very limited medical reasons for individuals not to be able to wear a face covering. While we hear often cited that is because they have difficulty breathing, that is not a reason medically for not to wear a face covering. Usually it's just that they hear themselves breathing when the mask is on, and therefore they just need to take some time to get used to them. Start off by only wearing it for 10 to 15 minutes, and then expand a little bit longer and a little bit longer until you can wear it for a prolonged period of time. I always remind people that we have surgeons who have breathing difficulties as well, and yet they are comfortable wearing a face covering or a face mask during surgeries. It often is just taking care to do that. The biggest things that we see that people who can't wear face coverings are those that have trauma or facial structural abnormalities that make it difficult for them to have something over their face, or if unfortunately they've been a victim of a trauma and it traumatizes them to have that experience again with face covering. Again, children, it may be developmental and behavioral issues as well, but most people can tolerate them.
Yeah, great. Thanks. There's actually a follow-up in this grouping that I'm going to take. This is a particularly hard question. What is the best approach to get the employee that fights you at every step about wearing a face mask to willingly wear a face mask? And I think the best answer to that is to take the information that Dr. Shah shared with us in terms of the science behind it, how it evolved, why it's different now than in March. And be able to explain what the benefit of it is. It really is about partnering with the employees, giving them the full understanding of the science that's available to support it, and then move forward from there. Beyond that, it becomes HR issues, and you'll need to tap into those kind of resources to how to best move forward. So our next questions are for Dr. Shah. Actually, they start off with a rather bold comment followed by a question. So I'll go through them methodically. So the bold statement is no temperature at the door, stating that is up to the schools as this is not significant in elementary school kids. I tried to explain that we have adult bodies in the high school, and as this is a deadly pandemic, isn't worth dividing the schools by elementary, middle, and high school. So I think part of the question is about the temp at the door, and then is there a rationale to divide them up by age groups?
I'll start with the age group piece. There are some early data published 2 weeks ago based on a study that was conducted in South Korea, looking at the differences in the ways that young people can transmit COVID-19. So not so much whether they can get it, but whether they can transmit it. And one of the things that was a finding of that study, and it was just one study, I should be clear, was that individuals over the age of about 10, functionally from a transmission perspective, are more akin to adults, whereas younger children, those below the age of 10, seem to transmit the virus less. There are, as you can imagine, a lot of implications for that data when it comes to schools. When we think about schools from a public health perspective, we think about the risk to children, and then we think about the risk from children. There are some early data, again, to suggest that children are less affected, less severely affected by COVID-19. They can still get COVID-19. There is no question about that. The data show that children can be affected, but the severity of their illness seems to be less than that of adults. The same thing applies with things like temperature checks. Many of the children who get COVID-19 are asymptomatic or very mildly symptomatic throughout the course of their illness, in lower percentages than adults are. And so then we have to think about other mechanisms to limit the transmission. That's why face coverings, again, in school settings become ultra important, because children may not manifest symptoms the same way as do older adults, but they could still potentially transmit it to their classmates or to the teachers and staff in the schools. That's why even in schools, having those face coverings on, we recognize how hard it is for kids to keep those on, but they take outsized importance in school settings.
Great, thank you. So we have a host of questions with a short amount of time, and I would be remiss to not say, Dr. Shah, perhaps you could forego the 2 p.m. media briefing and continue answering our questions. But so I apologize to our audience. We actually have many more than we can answer. So I'm going to selectively pick ones that are, broadly pertinent to people. So here we go. If a COVID-19 case develops at school this fall, what steps will CDC take, such as contact tracing, mandates for closure, et cetera?
So it's a little bit of all of the above. It really depends on how many students, where, what the nature of their exposures are. And so we have plans in place and are working on refining those plans to take into account the possibility that there will be children in schools that come down and be tested positive for COVID-19. And yes, there will be contact tracing. There may be different levels of testing based on where the child may have had exposures. The same thing applies for teachers. If a teacher were to test positive, there are plans in place to make sure that students that the teacher may have exposed are similarly tested and quarantined, and that quarantine may extend as far as an entire classroom. So the challenge is there, but we are working on the plans to respond if and when that may happen.
Thank you. Next question, Dr. Shah. Employees are asking whether they are expected to quarantine for 2 weeks or take a COVID test if they leave Maine to check on their parents or relatives in Massachusetts or Rhode Island for a day or a weekend.
So I'm going to be straight with everybody. I know this is not an easy answer, but the answer is yes. No matter the purpose of your visit, even if it's to visit an elderly relative, there's still the possibility of contracting COVID-19, bringing it back and exposing other vulnerable folks here in Maine. And so no matter the purpose of the visit, even as something as noble and as important as visiting family members in Rhode Island, Massachusetts, or any of the other states, a negative test or a 14-day quarantine is the best and most responsible way to prevent COVID-19 from taking and getting a foothold here.
Thank you. What about immunocompromised patients, including those with chronic diseases like diabetes and asthma? How do you determine when it's safe for them to return to work?
Boy, that is a tough question.
That's a big question.
That's a really tough question, but let me just connect it with the last question, which is the reason why it's important for folks who are even visiting parents in Massachusetts or Rhode Island to get tested is because of the fact they may inadvertently infect someone who's immunocompromised here in Maine. So the two questions are very intimately connected. Now, when individuals who are immunocompromised or have chronic conditions can return to work depends almost entirely on what their working conditions are. If they're working in a crowded environment with other individuals, that's one thing. If they work in a very sparsely populated environment, then it's another thing. So it really does depend almost entirely on the nature of their workplace.
Next question, and Dr. Shah, I apologize that I'm not giving you any break here, but we only have a few minutes left. Great, thank you. So positive results are reported to the CDC in a person's state of residence for counting. What is done in Maine to understand the COVID-19 burden in communities with many out-of-state visitors? How do we reconcile that?
Well, we keep tabs on the data that are coming in from individuals from out of state as well. And if we see that there are outbreaks associated with individuals who are out of state, we act no matter what. But the fact is, since we've started keeping our data, out of approximately 170,000 tests for COVID-19, about 170 of them have been in individuals who have out-of-state address. So about 0.1%. I know there's a lot of concern around out-of-state individuals, and we know that down east there have been an uptick in the number of individuals from out of state who have positive test results. We're working with hospitals, say on MDI, to make sure we can track those contacts of those individuals so that the transmission is limited. But what we've seen in terms of out-of-state individuals is that although there are some, many of them, for example, are individuals from New Hampshire who happen to come across the border and get their health care in Maine. We are always taking a look at the data to see where positive cases are. And if we detect individuals as being part of an outbreak, we react irrespective of what the state of residence is. We also look at those data indirectly. So for example, data around hospitalizations are reported no matter where somebody lives. If you're in the hospital in Maine, you're counted in our data. It doesn't matter if you're a New Hampshire resident or a New Mexico resident, you're part of the data. So that's how we think about individuals from out of state.
Mm-hmm. So with the influenza season coming upon us shortly, would you recommend that providers test for both influenza and COVID?
Well, I actually think Dr. Jarvis would be in a better position to answer that than I. What I will say is that we are prepared at our laboratory to make sure we've got the capacity to run both in high volumes. The clinical question is one that Dr. Jarvis is better positioned than me to answer.
So we'll pass it over to you, Dr. Jarvis.
Yeah, so yes, we are. That is what our intention will be, is that we would test for both viruses. Our hope is that we will be able to do that with a single swab. There are some complexities to that, because we don't want to have to subject people to 2 nasal swabs in order to get the results. But there's just some technicalities that need to be worked out. But it is important for us to know that, because if we know that if somebody's positive for influenza versus being positive for COVID-19, it is definitely different in the precautions that we give and the advice that we give to those individuals. There are treatments for influenza that may be appropriate that certainly do not work and have no appropriateness for COVID-19. So it is important for us to be able to distinguish between the two. We just have to be able to do it in a timely fashion. We have always been very good about being able to do influenza testing in a timely fashion, but as you know, we are continue to be hampered by doing that with COVID-19. As we get better at doing COVID-19 testing and start to process when influenza season hits, I think we'll be doing both at the same time.
Great, thank you. So this is leading into the final questions that we have. Dr. Shah, how do we reconcile the wisdom of taking care versus mandates beyond our immediate control, such as return to school?
Well, this is a challenge. There's no question about that.
Mm-hmm.
This is definitely a challenge because there's only so much in any one person's sphere of influence that they can affect or change the outcome for. And so my recommendation is that you focus on those things that are within that sphere of your own control. In this case, one of the best ways to, for example, keep kids going back to school safely is to reduce the level of COVID-19 that exists in the community overall. That's the key to keeping kids back in school. So you can do your part in helping kids return to school safely by helping to keep the level of the virus in the community as low as possible. How can you do that? By wearing those face coverings, by maintaining that physical distance. Indirectly, by doing those things, you lower the level of COVID-19 in the community, which then facilitates the return to normal life, or as close to as we're going to get. That entail things like going back to school or going back out and re-socializing.
Great, thank you. So this is the last question I'm asking of both of you, starting with Dr. Jarvis. What are a few key points you'd like our audience to walk away with today?
First and foremost is practice all of those things that Dr. Shah just mentioned. They will do everything we can to keep each other safe. Second is to think critically, and I liked the questions that I see coming up in the chat as well as the ones that you gave us, Ed. People are actually thinking about, hey, what does this mean for me? And what science is behind what I'm doing? And I ask everyone to think critically, particularly when you see that tweet, that Facebook post, that share from your friend that just doesn't seem logical. Think critically and find out where that came from and see if anybody else is saying the same thing. There are many reliable sources, including the Maine CDC's website, the federal CDC's website, and Northern Light Health's website that can give you accurate, timely information.
Excellent. Dr. Shah.
Okay, well, Dr. Jarvis took my cues, so I will.
Well, you took one of mine earlier.
I will build on. I completely concur with what Dr. Jarvis noted. I will add 2 things to it. The first is, even though we're in this weird world in 2020, where we're wearing face coverings and we're staying apart, we don't want to let that generate an aversion to socializing and remaining connected to folks. we also don't want to let that generate an aversion to not exercising and not enjoying the outdoors. So it is possible to do both, and I encourage everyone to stay socially connected, to get outside, exercise, and enjoy the beautiful summer. The other thing is somewhat a topic we haven't talked about, but well, actually we talked about vaccines, so we have talked about it. Now is the time to start having conversations with your family and your doctor about vaccines. The best way to start preparing for a COVID-19 vaccine is to make sure that you and everyone in your family, adults and children alike, are fully caught up on all the current vaccines. We're getting ready to have kids be back in school. Then now is the time to make those appointments, call your physician to make sure your child is up to date. But adults too have a vaccine schedule. So now is the time, as you're getting your kids back in to see their doctor, make sure you as the adults are getting up to date on all your vaccines. That's the best way to build that strong foundation to be ready for COVID-19 vaccines.
Excellent. So I have a couple of apologies to make. First apology is that I didn't ask Dr. Shah to stay for another hour. The second one is an apology to all of those that had put in the questions in our chat box that we haven't gotten to. So thank you, Dr. Shah and Dr. Jarvis. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information and insights to collectively and safely reopen Maine. We hope you have found the last hour a good use of your time and you were able to identify some useful tips to apply to your business. Next week, we will have numerous business leaders who have reopened and they will share their experience with all of us. The following week, the theme will be outbreaks, probably near and dear to Dr. Shah's heart. Our guests will share their experiences with dealing with outbreaks right here in Maine. We will send you the link along with the topics for week 10. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together, we will help Maine safely open back up for business. Thank you and have a good afternoon.